United States election is November.
There you go. Okay, we're talking about opiates and opioids. Opiates come from are the natural drug, and the opioids are the synthetic version. The opiates come from the opium poppy, and this is what the opium poppy looks like. When it has a head like this, there is exudate in there, and you can, if you cut the pod, then it will leak, and then you scrape all the juice that comes out. It usually will ooze for about a week.
A week?
A week. And you can milk it about 6 times in that time, in that season. Opium produces over 25 alkaloids. The two most important are codeine and morphine. Codeine makes up about 0.7% to 2.5% of the opium exudate, which isn't a whole hell of a lot. Morphine makes up 10 to 20% of the opium exudate, which is better, I guess. A third alkaloid that is a stimulant rather than a depressant is thebaine, but you don't hear very much about thebaine.
What is that? Thebaine?
Thebaine, it's a stimulant rather than a depressant. Okay. We don't do anything with it that I'm aware of.
I never heard of it.
Semi-synthetic opiates or opioids or opiates or opioids that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. That would be heroin. It's partially synthetic and partially natural. Hydrocodone or Vicodin, oxycodone or Percodan or OxyContin. Hydromorphine, which is Dilaudid, which you know all these, yeah. You probably distribute lots and lots of Vicodin and Percodan and Dilaudid. Probably not so much Dilaudid, but Percodan and Vicodin. A lot. Fully synthetic opiate-like drugs, methadone, which is used in heroin treatment. Demerol and Darvon, of course, meperidine and propoxyphene, you probably deal with. Or in the old days, we used to deal a lot with Darvon. Yeah, we had a lot of. We were distributing a lot of Darvon. Demerol, of course, is what you knock people out with. Yeah, in the emergency room, meperidine. Synthetic opioid antagonists, naltrexone and naloxone. And they work very, very well. They block the feelings of opiates and opioids. Somebody is overdosing, you can give them naloxone or naltrexone, and you can stop the reaction. Opium poppies were first cultivated in ancient Mesopotamia, then spread north to Greece and west to Egypt, eventually making its way east into Asia. Opium was used in many medicines in the old world, but its ills were seen even then when various writers wrote of its addictive properties. It has always been highly addictive. Opium tended to be used as an additive. It was eaten, chewed or mixed with liquids, and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture. He mixed it with anything that's a tincture is mixed with alcohol. So tincture of this, tincture of that. It's always mixed with alcohol, and that's the medium. He mixed it with opium powder, and he created laudanum. They used laudanum to treat dysentery, pain, diarrhea, and coughing. And it works very, very well. And of course, it was used into the 20th century. It's very popular in the 19th century, especially in the middle of the 19th century. Opium continued to be used in medicinal mixtures for the next 3 centuries. Paregoric, which is tincture of opium with camphor, to make it taste better, was developed for the treatment of diarrhea. My mother had gallbladder disease, and she had a real serious problem with diarrhea. and she took Paregoric for that. I remember her telling us to go call the doctor, telling to order her some Paregoric. And he did, of course, because she was a nurse. This mixture is still used today, of course, the Paregoric is. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredient into the system much, much faster, 7 to 10 seconds. Because of the psychoactive ingredients enter the bloodstream and brain faster, there is a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involves heating the substance in tinfoil and inhaling the fumes through a straw. It is known as chasing the dragon. And here's a picture of a young lady chasing the dragon. She's got heroin on that tinfoil, and she's cooking it. Because it's tinfoil, of course, it heats very rapidly.
Bruce, like in old kung fu movies,
Yeah,
aren't they smoking opium in the bins?
yeah, probably.
They go along pipes.
Oh,
See
well,
guys,
yeah.
you-
Yeah, they're just all laid out. 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more effective painkiller. Morphine was first used in the Crimean War. From 1853 to 1856, Crimean War was between the Brits and the Russians over Crimea, and the Russians won. It was also used during the American Civil War. Opium poppies were actually grown in the South to provide morphine for the Southern troops. The North blockaded all the ports, so they had a difficult time getting any medicines into the southern states. In 1832, the weaker alkaloid codeine was isolated from opium. It was found to only be twice as strong a painkiller as opium. Codeine was used to treat coughs and general neuralgia, which is muscle or nerve pain. It's not a very strong painkiller. 1874, a British chemist boiled morphine with acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany, who seemed to be buying just about anything like aspirin, bought the chemical and named it heroin. Its effects were heroic on the individual. That's the reason they named it that. They marketed it as a cough suppressant, a chest pain killer, and a treatment for tuberculosis and pneumonia. And this is one of the things you need to remember about the 18th and 19th centuries. A lot of tuberculosis. Consumption is what they referred to it as, and there were a lot of people that were suffering from this. The biggest problem with tuberculosis was you coughed so hard that you ruptured blood vessels in your lungs, and then you started coughing up blood. Once you started coughing up blood, of course, if it hemorrhaged, you could die. So one of the things they were trying to do was slow down the hemorrhaging. They were trying to slow down the coughing so that the people wouldn't gag themselves to death. And that was the use. That's why they used opiates and opioids. As weird as that is. Tuberculosis is a really serious problem. You died of tuberculosis, but if you caught pneumonia, you died. We had no antibiotics to treat pneumonia, so if we could, and of course, when you got pneumonia, you want to get the stuff out of your lungs. If you don't, your lungs will fill up with fluid, you'll drown. But of course, it was one of those balances between coughing yourself to death and drowning of fluid buildup in your lungs, as ugly as that is. A lot of people dying of these things. And it wasn't that long ago, it's like the 1950s, that if somebody got sick, they died of pneumonia. They would have other diseases, but of course, because they were sedentary, they would lay down until their lungs started filling with fluid, and then they would develop pneumonia and die.
What exactly is pneumonia?
Pneumonia, It's usually a bacterial infection, and of course, that causes a reaction where fluid fills up in the area, in your lungs. Once it starts filling up with fluid, you can't breathe anymore, and you die of pneumonia. You die of a buildup of fluid in your lungs.
How's a baby get it?
How does a baby get it? Well, they have tiny little lungs.
No, I mean, from the hospital. How's an incubator for 3 months? Like, I had him in the hospital.
Okay.
How does that happen?
How does that, you mean, how would a baby get pneumonia?
Yeah.
Well, there's all kinds of bacteria floating around in a hospital. They just had a problem with fungus in a couple different hospitals. I can't remember where they were. But they're someplace in the United States, but the babies are dying of pneumonia caused by fungus. So anything can cause pneumonia. Pneumonia doesn't have to be a bacteria. It can be viral pneumonia, it can be bacterial pneumonia, it can be fungal pneumonia.
It's dangerous.
Yeah, pneumonia just means that your lungs are filling with fluid. And usually it's because of one infection or another
Yeah.
type of infection.
Sometimes it's like pus, right?
I'm sorry?
Pus in your lungs.
Yeah, in essence, that's what happens. So whether if it's viral, it's a real watery substance. If it's bacterial, it's a really mucoid substance.
Yeah.
And your lungs just fill up with fluid of one ilk or another, whether it's very liquid or more mucoid, and that's pneumonia. And then you can't, I mean, you need your lungs to breathe. They fill up with fluid, you're in pretty bad shape. Yeah, you're dead. So, and we see this all the time, unfortunately. Heroin crossed the blood-brain barrier more rapidly than morphine, and for that reason, heroin was heroic. The result was a more intense and rapid rush in euphoria. It's estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine and heroin addicts in the United States. This became very popular. Emory. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, coughs, diarrhea, and toothache. So we're treating it for any kind of pain, but of course, coughs have to do with pneumonia and tuberculosis. They were used to quiet loud children and to aid in sleeping. As stupid as that sounds, they were knocking their kids out because you know how children should be heard and not, seen and not heard. So they wanted them to stop making noise. So they would treat them with heroin.
That's cool.
How much fun is that?
Such a good time.
Surprisingly, surveys showed that more than half the opium addicts were women. 56 to 71% were women. So yeah, sure. Of course, you know they need to be resting. So they're sitting there all stoned and whatnot. And the kids start making noise. So what do? They hit them with a little bit of heroin, and the kids are suddenly not making noise anymore. Famous opiate addicts of the 19th century, Jane Addams. Jane Addams was the first social worker. She set up a house for immigrants in Chicago. She and, I can't remember the other lady's name. Anyway, they set up a place and they tried to help immigrants assimilate into American society. The famous actress Sarah Bernhardt was an opiate addict. The author, or the poet, Elizabeth Barrett Browning, was an opium addict. Charlotte Bronte, one of the Bronte sisters, was an opium addict. Louisa May Alcott, another famous author, was an opium addict. Samuel Coleridge, a poet from the 18th, beginning of the 18th century. Charles Baudelaire was a French poet. Lord Byron, of course, was an English poet. John Keats, another English poet, opium addict. Edgar Allan Poe was a famous opium
Yeah,
addict.
something, his stories, man.
I know, he died in his 40s. The saddest.
What's it all authors?
Um,
They just write and get out?
They're the literati, they're the people that are so, they're very sensitive, so they would need to use a substance to relax themselves. And
Well, him I could see, because I mean, his stories are pretty freaking dark. Man.
oh, well, the rest of them have pretty good stories too. Samuel Coleridge.
I heard of Alcott. I heard of her.
Oh, sure.
Never heard of the rest.
Edgar Allan Poe. Algernon Swinburne, an author from, English author. Opium, morphine, and heroin became a health concern in the United States around the turn of the 20th century. Remember, we said that there could have been as many as 1 million heroin addicts at the turn of the 20th century. And of course, now we're going to try to control this. 1906, the Pure Food and Drug Act was passed, limiting the manufacture and use of opiates. In 1914, opiates became the first drug considered a narcotic in the Harrison Narcotics Act. In 1924, heroin production was outlawed in the United States. Okay, so we've got this movement at the beginning of the 20th century to stop all of this stuff. Anytime we have a movement like this, it has to do with politics. So if you think about it, what was going on at the beginning of the 20th century? Who were we trying to control? What group of individual were we trying to throw in prison? And the answer is immigrants. Immigrants, but especially Asian immigrants. Most of the opium dens were in Chinatown. So we were trying to, and we had outlawed Asians from coming into the United States in 1889. The Asian Exclusion Act actually was called the Chinese Exclusion Act. So we were trying to stop Chinese people from coming into the United States. But we were also, in stopping the Chinese, we also stopped the Japanese, and we stopped the Koreans. Anybody from Asia was outlawed. We wouldn't allow them into the United States. So we were trying to stop these people. We were also trying to stop any immigrants that used drugs. The idea was that only immigrants would use drugs, whether they were Asian immigrants or whether they were European immigrants. So we did this in order to slow down and stop immigration into the United States, as god-awful as that is. 1915, only 63 people incarcerated in federal prisons were incarcerated for narcotics violations. Now you would think we had just passed a law so we could throw anybody in jail that we wanted, so why in the world didn't we have more people in jail who were narcotics addicts? Because we deported them. If we found somebody, if we found somebody that was strung out on opium, or we found that they had any opium, we kicked them out of the country. If they were from China, we kicked them back to China. If they were Japanese, we sent them back to Japan. If they were Italian, we sent them back to Italy. That's one of the reasons why we only had 63 people. The only people that we were incarcerating were people that had been born in the United States. And if you were born in if you were a second generation immigrant, which sometimes we sent you back to your country, not your country of origin, because this is their country of origin. We would send them back to their parents' country of origin. As illegal and strange as that sounds. By 1928, 1 out of every 3 people were incarcerated because of narcotics violations. We had about 2,529 prisoners. By 2004, 86.5% of the federally incarcerated prisoners had been convicted on drug offenses. Most of them had to do with some fairly severe drugs. We're not really talking about marijuana here. We're primarily talking about cocaine, crystal meth, heroin. 155,900 prisoners out of 180,328 were incarcerated for drugs. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. These already existed in their home countries. The Chinese triads, very strong, very powerful, controlled much of China. China was a fairly lawless place. This is in the 20th century. The empire collapsed in 1911. So after that, it was pretty much the drug cartel, or not the cartels, but the Chinese triads that controlled things in China. The mafia, of course, the Italian mafia, and the mafia comes from Sicily. The French connection had to do with the people of Marseille, which is in southern France. But of course, they got their drugs from North Africa, from Algiers. So the French connection is very strong. Mexican narcotraficantes, these were the Mexican movers of narcotics. There were African traffickers that came out of Nigeria and the Gold Coast. The Russian Mafia, of course. The Russian Mafia, after the collapse of the Soviet Union, the Russian Mafia became extremely powerful, especially in New York City. And this is one of the reasons, this is one of the things they don't talk about when they talk about Donald Trump and Russians, because the Russian Mafia is extremely strong, extremely powerful in New York City. And of course, that's where he was headquartered. And nobody has mentioned the fact that there's a possibility that there's a Russian Mafia connection between Trump and, that's on tape, isn't it? I could get arrested. Between Trump and the Russian Mafia. What?
No, it'll be all right.
Okay, sorry about this.
Free speech, man.
I don't know. We got a new president.
We'll see if we see Dr. Bradway next week.
If I'm gone,
Take those black side, man.
Colombian cartels, of course. So as you can see, we've got drugs coming in from just about everywhere, just about anywhere. At present, 4.6 million Americans use opioids illicitly every month. I looked this up just before I came to class, and it's still about the same thing, 4.6 million. Only 136,000 to 800,000 of these individuals are heroin users. The figure that I got was in the 400,000 range. 3.5 million people in the United States have tried heroin. Heroin's not easy to come by. Well, I guess it's a lot easier now to come by than it was before. What we have done is we've created an addiction. We've created an addiction with our pharmaceuticals, and because they can't get their pharmaceuticals anymore, they switch to heroin. The rest are prescription drug abusers, OxyContin and Vicodin. A new wrinkle that is appearing in the Dallas area junior and high schools is cheese, a mixture of a little Mexican brown heroin and over-the-counter medications containing antihistamines. The mixture gives the individual a bit of a rush, not a whole lot. This is in junior high school, okay? This is 12-year-olds. Several deaths have caused a nationwide scare, but it was because they mixed it with too much Mexican brown. Worldwide, 5 to 10 million people are regular heroin users. The United States only consumes about 3% of heroin produced. So if you go to Europe, you see a lot more strung out people. There's a lot more heroin addicts in Europe than there are in the United States. The areas, it's easy, it comes in very easily into Europe. It's coming in from Russia, it's coming up from Marseille. There's a strong African presence in France and the Netherlands and England, and because of that, it comes up through Nigeria. 92% of the world's heroin is produced in Afghanistan, which seems a little weird.
It's true.
Since we control Afghanistan right now, but still, I told you the story of what happened with my brother. When my brother was there, and he was in control of one of the provinces, he controlled heroin in that province, and they slowed down. Everybody was going, yeah, it's okay, it's okay. And they just warehoused this stuff. They just put it in warehouses. But my brother, it's a year-long combat tour. It's a 13-month combat tour. And so when he rotated back to the States, the guy that took over for him was a Christian evangelist. And he pissed off the Muslims so much by preaching to them. They don't like that. Who does? Who likes being preached at?
Well, that's just that, but it goes opposite of what they believe.
I'm sorry?
It's opposite of what they believe.
Yeah. Well, it pissed him off. They got pissed off because this guy wouldn't leave them alone. So they sold all the stuff out of their warehouses and made lots and lots of money. But while my brother was there, they had stopped marketing it. They weren't marketing it anymore. And they were starting to grow other things, food, for
I
example.
had a garden of freaking puppy food. So, we're literally just sitting there like, what the hell?
Yeah.
The Humvee or MREV just, just sit there.
Doesn't make any sense.
12 hours.
That's their economy. You have to be like guarding a factory or something. Most of the world's legal opium for pharmaceuticals comes out of India. Most of the heroin coming into the United States comes up from Mexico. Mexican brown.
Carga.
There you
They
go.
call it.
Yeah. Or tar. Medically, opioids are prescribed to deaden pain, control coughing, of course, and stop diarrhea. Non-medically, opioids are used to drown out emotional pain, to get a rush, to induce euphoria, and to prevent withdrawal symptoms. Are the withdrawal symptoms that severe? No. Withdrawal symptoms from alcohol are worse. People rarely die from trying to come down off of opium, of heroin, or any of the opioids. It hurts. It bothers them. They don't have the euphoria.
I've seen a person go through it, and it feels like, he said it feels like someone's taking their bones and just twisting it
Exactly.
and hitting it at the same time.
Exactly.
Man, it's terrible.
But see, they don't die from this stuff. They do die from alcohol withdrawals.
Yeah, it's rough for about maybe 3-4 days.
Yeah.
After that, they're okay.
Yeah.
You know?
Yeah, it's possible, it's not that hard, feels like the flu.
Really bad flu.
Well, the flu hurts.
I don't know, I guess it depends how much you use these stuff.
Yeah, if he's mixing it with something else, then now he's got a problem. Pain is transmitted to the central nervous system through the neurotransmitter substance P. The P stands for peptide, not for pain. The more substance P that is released in the synaptic cleft, the greater the pain that you feel. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers. So we have a natural painkiller. We have neurotransmitters that are trying to control the pain. Endorphins, enkephalins, and dynorphins. We talk a lot about endorphins, like they're the only painkillers, but the reality is we have lots and lots of other painkillers. Lots of other enkephalins, we have dynorphin. Endorphin is just one, it's just one of them. And the reason that we talk about it so much is it's because it's the first one we ever discovered. But there are others in there. I don't have hardly any endorphin receptor sites in my body.
What does the word orphan mean?
Endorphin, it's just...
No, orphan, because I know there's dino-orphan, endo-orphan. Endo's inside.
I don't know, I'm not sure. I'm not really sure. That's something that I would like to look up though. Now that you mention that, I think.
No, it's just, you know, there's.
It's probably a chemical structure. But I don't have very many endorphins, but I played sports all my life and I get hurt all the time because I'm dumb. And I block it with enkephalins and dynorphins, obviously, since I don't have any endorphins. I don't have runner's high. I don't get runner's high, which is irritating. Everybody else goes, dude, I hit a wall and then I got a high, man. I never get any of that stuff. The endogenous painkillers occupy substance P receptors, opioid receptors, referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opiates, opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious. They decrease anxiety. They produce a sense.
Uh-oh.
It wants me to.
Yeah, the internet's been acting freaking weird. I was in the middle of watching this show, and it went off. I was pissed because it was the last episode, like, forever.
And you missed it.
No, I mean, I got it, just took about an hour.
What a pain.
It's this show called Counterpart.
Okay, so the endogenous painkillers block, they decrease anxiety, produce a sense of detachment. They make the individual feel drowsy. They deaden the unwanted emotions that you're having. And this is all done with endogenous painkillers, endorphins, enkephalins, and dynorphins. These effects occur because the inhibiting effect of the endogenous or exogenous painkillers affects on the locus ceruleus. Locus ceruleus is what is activated when somebody has ADHD. Opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers, inhibiting the action of GABA. It triggers glutamate receptors, enhancing dopamine neurons in the reward reinforcement pathway. It increases the release and enhances the effect of dopamine. Heroin has the strongest effect of all the opioids. And this is the reason why people take it. Did you figure out what orphan meant?
No, it's, I think it says orphan,
Like
orphan.
an orphan, yeah. A little orphan. The reward reinforcement pathway performs two functions. It signals pleasure so that the act is more likely to be repeated. It signals the alleviation of pain. Research has disclosed that the relief of pain is a stronger incentive than the introduction of pleasure. And you've heard those silly jokes where the guy hits himself with a hammer and they say, "Why are you hitting yourself with the hammer?" And the guy says, "It feels so good when I stop." As stupid as that is, but that's real. Mm-hmm. That is very, very real. People like pain because it feels so good when it goes away. With psychoactive drugs, especially opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. So when we're talking about heroin, we're not really talking about the feelings that you get when you are taking heroin. Because mostly what they're doing is they're trying to keep from having withdrawal symptoms. That is painful. And what they're trying to do is stay away from the pain. So when you're wandering around and you're looking at all the people that are smoking pot and they're taking crystal meth, and they're snorting cocaine, and they're shooting up with heroin, some of these people are doing it because it feels good. But the heroin user is doing it so that he won't feel bad, as weird as that is. And, well, it's not that weird. So if you're around somebody who snorts cocaine, they're up, they're happy, this is important to them. Same thing with crystal meth. They're trying to feel a different emotion. But if you're around a heroin addict, you're around somebody who's just trying to stay away from feeling bad. And usually the feeling bad, the worst part of the feeling bad is the fact that he is inducing the bad feelings himself. It's not like he's got this bad leg and it hurts so much and he has to take the heroin. That's not what we're talking about.
It won't come up. It just goes straight to orphans.
Damn orphans. Anyway, okay, so it's they're trying to stay away from the pain, as weird as that is. When an individual is prescribed opioids, a non-abuser will use the medication until the pain relief threshold is found. That's what you're trying to do with your drugs. You're trying to alleviate the guy's pain. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opioids will be, okay, think about this for a second. You've got a pain and you take a pill and it goes away. It feels better than if you don't have a pain and you take a pill and you feel happy. Remember, the relief of pain is a stronger inducement than pleasure. So this person isn't feeling anything positive, he's just, the alleviation of pain makes him, gives him this feeling that he has done something to himself. So if you line all these people up and you see that this guy's sad and that guy's sad and this guy's sad, why are they addicts? They're heroin addicts. These guys are heroin addicts. These are not very happy people. Okay, so because they're not finding joy in what they're doing. They're just alleviating the pain. I was told one time by a heroin addict that taking heroin feels like you're dead. And why in the world would you take a drug that makes you feel dead? He says, well, it just, before it hurt. Before I was in pain, and now I just don't feel anything at all. And that feels so good compared to what he was feeling before. That was his rationale for being a heroin addict. As stupid as that sounds. An abuser will use beyond the pain relief threshold and search for an emotional high, which he never finds, by the way. Chronic users of opioids, it's just a relief. It's just like an empty feeling. And that's what they're after, is that empty feeling. Chronic users of opioids will use the drug in excess to prevent the withdrawal symptoms. They're seeking to return to the normal state. But they'll never find the normal state because they've created a state where when they're not using heroin, it's a negative state. So all they're doing is going back to a neutral state. I know none of this makes any sense. Everybody else is doing things so that they feel better. These people are doing it so they feel better, but it's to take away a negative, not to add a positive. Opioid-like receptor sites have different functions. Mu and sigma receptors trigger and reward reinforcement pathway. They block pain transmission. They change mood. They cause pupil contraction. They depress the autonomic nervous system, which means the respiration goes down and blood pressure is reduced to the point of going away. Kappa receptors induce dysphoria. They induce endocrine changes. They control pain at the spinal cord level. Opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. Robitussin AC. This is so stupid. Because they drink this stuff to the point that they get this psychedelic reaction from it, and then they die. And why do they die? Because they can't cough. So they gag to death. Oh, God, it's so stupid. Vicodin syrup is another one, Robitussin AC. People will abuse these substances for the psychedelic effects. Unfortunately, an overdose, it's usually not just the cough syrup. They're usually drinking. This was real big back in the early 2000s. They would go to clubs and they would down a bottle of Robitussin or Vicodin, and they would drink it with Cristal, or they would drink it with tequila. And of course they're mixing. Yeah.
What was that other thing that people drank to? They mix like the codeine with like Sprite or something.
I don't know. I'll just.
He stays away from
I
this.
just drink a Corona, man.
I've seen people.
But yeah, a lot of rap stores just freaking. I think actually one went to the hospital because.
What was it called? What's the name of it?
But yeah, it's cough syrup and like a bunch of other stuff.
Yeah. yeah, you can take a lot of things. And of course, you do get the psychedelic effect. And at least they died happy, or died not coughing,
I know
actually.
what you're talking about, I just can't freaking remember.
Yeah, I
Unfortunately, an overdose of the psychedelic substance dextromethorphan, and they used to brag about dextromethorphan. If you watched advertisements about Robitussin, this is what they were talking about, dextromethorphan. Well, that's a psychedelic substance. It can cause respiratory suppression, nausea, and vomiting. Overdose of cough suppressants is usually in combination with other depressants, such as alcohol, benzodiazepines, and antidepressants. So if you're taking cough syrup, you can't take anything else, because you may overdose and not be able to recover, and that has happened. Opioids are also given to control diarrhea. Opioids work on the brainstem to inhibit gastric secretions and depress the activity of gastric muscles. Opioid addicts may suffer from severe constipation. Severe constipation is blockage in your intestinal tract. Who was it that had to have he had a blockage in his intestine because of his heroin usage? He was an actor, famous actor.
Who?
He's a Scottish actor.
is he recent?
Yeah, he's still alive.
So,
He was in Love Actually.
I don't know, I was checking it.
He was in Rob Roy.
Ah, crap.
I can't think of his name.
You can imagine him though with the sword and the long hair.
Yeah, but he had and the reason he had a blockage in his intestine was because he was a heroin addict. Heroin's not that hard to get off of. Like I said, it's not, withdrawal symptoms aren't as bad as withdrawal symptoms from alcohol.
He was in Liam Neeson.
Liam Neeson, that's it.
Really?
Yeah, Liam Neeson,
What the heck?
yeah. He had to have
Shit.
And then
his
that's
bowel
for,
resected.
and that's for people that use it like regularly, they can.
What, heroin addicts?
Yeah, that.
Yeah, you don't poop. All right.
Yeah, so you can't shit?
I'm sorry?
You can't shit?
No, your bowels aren't working.
That sucks, man.
Well,
I guess you really don't know because you're not eating on the crap, right?
well, I guess potentially that's what's going on, but these people aren't having a bowel movement for weeks on end. And you know, that stuff needs to move through your system.
Yeah,
Feces is toxic. And that's one of the reasons why it needs to move out of your system. You need to keep pumping that stuff out, and that's one of the reasons why exercise is so important.
Yeah.
Because it's just naturally, it moves this stuff through your system. If you're not having bowel movements, that means that whatever feces is in there is just sitting there. And if it's just sitting there, it could cause cancer, it could cause polyps, cause all kinds of interesting problems. So this is a really serious problem. This severe constipation can be really serious. As in the case of Liam Neeson, he had a blockage. He had a blockage to, oh God, you don't want me to start talking about this problem, because when people get old, if they don't, of course they stop moving. And if you stop moving, then that stuff doesn't move through your system very fast. So sometimes, if you're talking about, this is one of the reasons that they give people laxatives. This is a horrible subject. This is one of the reasons they give people in nursing homes laxatives, because they need to poop. And this is one of the reasons why old people talk about their bowel movements all the time. As long as they're having them, they're okay. As soon as they stop, now we got a really serious problem, because that stuff's going to turn into rocks in their gut. And I've dug that stuff out of somebody's rectum before. It is not a lot of fun. I mean, this stuff came out like bricks. And it ain't a lot of fun.
So it's like the same concept as like maybe like a kidney stone, it gets.
No, because kidneys,
I
kidneys.
mean, the same concept where it's passed through and it's hard.
Yeah, well, kinda, I guess, but it doesn't, I'm calling it bricks. It's still feces, you know, it still came out, and of course, we flushed it down the toilet, but it wasn't, it hadn't solidified as much as kidney stones do. But you know, this is a wide open system. You know, your intestines are this big around. The feces coming out of your body is fairly thick, it's fairly large. Your urinary tract, it's just supposed to be water leaking through that sucker. Yeah, that's kind of a different situation. So, yeah, you need to poop. Yeah, I've talked about this before. It's not a good thing. Opiates, opioids affect every part of the body, but especially your heart, your lungs, your brain, your eyes, your voice box, muscles, cough center, nausea center, reproductive system, excretory system, and the immune system.
Nothing important.
Nothing important, no, certainly not. This is the weird part. It affects your voice box. So if somebody's been taking heroin, their voice gets real raspy because, well, their throat gets real dry. So they get a real raspy voice. Physical side effects of opiates, opioids, but especially heroin includes insensitivity to pain, of course. It lowers your blood pressure, which is good if you've got high blood pressure, but if it lowers it to the extent that you don't have one anymore, now you're dead. It lowers your pulse, of course, which is a good thing, potentially. Lowers your respiration rate, which is okay. And of course, it makes you stupid, makes you confused. At longer doses, at stronger doses, opioids, but especially heroin, might cause droopy eyelids, which is one of the ways that we can tell. Nodding heads, there we go, okay. Slowed, raspy speech, slowed coordination and walking gait, pinpoint pupils. This is how we know if somebody has overdosed on heroin. They come into the emergency room the first thing, and they're only semi-conscious. First thing we do is look at their pupils. If they've had a stroke, then one pupil will be larger than the other, and that's not the way it's supposed to work if you've had a stroke. But if you've overdosed on heroin, you get no pupils at all. Their pupils are completely pinpoint. I mean, they're gone. You can't see them at all.
Yeah, right here in the picture, in the book, they're like,
Pinpoint pupils?
yeah, they're freaking small as hell.
Yeah, I know. They are, yeah, non-existent.
Jeez.
And that's how we can tell. So if you've had a stroke, we know it because your pupils aren't the same. They're not the same. That's not the way it's supposed to work. But if you've overdosed on heroin, you've got no pupils at all. Histamine release causing itchy, dried skin, which is kind of cool because their skin is kind of horny. Well, it's thick. It's kind of thick and dry. Suppression of the cough center, hindering the clearance of phlegm, of course. Vomiting due to the activation of the nausea center, which is kind of ugly because they can't cough, but they're throwing up, and now they can't get the stuff out of their throat. Severe constipation, which people rarely talk about their bowel movements unless they're really old people. Delayed menstruation, which of course is only for females. Reduced testosterone production in males, which means that the males don't want to have sex. Dulled sexual desire to the point of indifference. We can talk about crack whores, we can talk about women selling themselves for crystal meth, which is, I mean, that kind of stuff happens. A heroin addict is not going to be a prostitute. It doesn't work because they can't, it stops their sexual desire to the point that they can't do it anymore.
Yeah, but if they want it bad enough, they'll do whatever.
Well, maybe, but they're not going to lubricate, so you better bring the Vaseline.
I'd fuck with them.
Okay. Just take the Vaseline with you. Always carry a tube of Vaseline. Trying to help. I'm just trying to help.
But that, what's that stuff they use on cars, the JB Weld?
Well, okay. Well, I guess we shouldn't talk about sex with people. But, of course, you're not gonna find a heroin whore. It just isn't something that happens. That's the last thing on their mind. And of course, yeah, if they need the money, potentially they can, but it isn't with a lot of desire, let's put it that way. Tolerance for opiates, opioids occurs when the body tries to neutralize a toxin. It does this by speeding up the metabolism, especially in the liver. It desensitizing the nerve cells and the substance that the substance affects. Increasing drug excretion by increasing urine, feces, and sweat output. Of course, it's not going to increase feces output in somebody that's using heroin. Alteration of the brain chemistry to compensate for the effects of the drug. Opiates, opioids, tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. So, what a marketing tool this stuff is. So I'm going to give you your first dose. Tomorrow, you're going to buy twice as much as I gave you yesterday. And the next day, you'll buy 3 times as much.
It's called marketing.
That's exactly it. That's marketing. So I gave you your first dose. But now I'm making money hand over fist because you're trying to get the same high you got the first day that I gave it to you. Chronic use of opiates, opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opioids will reduce the dopamine-producing cells in the ventral tegmental area by 1/4. Remember, the ventral tegmental area is part of the dopamine reward reinforcement pathway. And we've just reduced it by 1/4, the number of receptor sites, which means you're not going to be able to be happy for the rest of your life. Hence, these individuals have less of an ability to feel pleasure or even feel normal. Another reason to take the drug, because now they don't feel good, they don't feel normal, so they need the drug to feel better. But the more they use, the less better they feel. Now we got a really serious problem. At this point, the body relies on the drug to feel normal, of course. It's the same way with alcohol. The only time you feel you need the hair of the dog in order just to feel a little bit normal. Withdrawal from opiates, opioids may take place in 3 stages. The acute withdrawal, the body tries to return to normal too quickly. The post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months and after use of the drug. Protracted withdrawal, more severe emotional symptoms that may start after the first month and last into the 30th week. Wait a minute, let's do the math.
7 months.
Ooh, 30th week? Oh yeah, 7 months, exactly. Decrease in blood pressure, decreased body temperature, decreased respiration, feeling of general uneasiness. This reaction might be triggered by environmental cues that incite memories of their addictive life. These cues can persist for decades after cessation of use. A lot of rock stars used heroin. They're still alive today. Steven Tyler was a heroin addict for a while. What he had to do was change his lifestyle completely. He couldn't be around anything that he did when he was a heroin addict, which was the mother of Liv Tyler had something to do with it. So Liv is his daughter.
Yeah.
Okay, so he left his mother, Liv Tyler's mother, who I'm not sure who she is, but he had to leave her because he couldn't be around her anymore because they used together.
Yeah.
Okay.
That's crazy.
Well, of course, Liv was only a little person. Short-acting opioids, 2 to 3 hours, result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. This is the case with heroin, morphine, and Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. As you can see, it's no different from just about any other withdrawal. After 2 days, the crisis time is 2 days later, and the withdrawal symptoms will last for about a week. So it's not that hard to, like I keep saying, it's not that hard to get off of heroin. Just have to do it. Long-acting opioids will delay the withdrawal symptoms for 1.5 to 3 days. That's why they use methadone. LAAM, we don't use this in the United States, it's real popular over in Europe, but we don't use it here. I think there's one clinic in the United States, but methadone clinics, we've got them all over the place. Scott was saying there's 2 in his neighborhood back home in San Diego. Peak withdrawal hits at the 4th to 6th day, and recovery may take as long as 2 weeks. That's if we are using the long acting opioids. Opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and the long term. Codeine, oxycodone, and Darvon are the the codeine-related substances. One of the curious withdrawal symptoms of opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by the opioids. All in all, people rarely die from opioid withdrawals, as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu, like I said before. The problem of opioids withdrawal is the fear of the withdrawal, since this is the area of the brain that is mostly affected by the drug. So it's not going to kill you, but it feels bad, and your brain is telling you that you shouldn't do it. And that's one of the reasons why it's so hard to get off of heroin. It's not a physical reaction, it's a psychological reaction. Neonatal effects of opioid usage are extreme because the drug readily crosses the placental barrier. Pregnant opioid users are at greater risk for miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia. And of course, this was, as I had told you before, my great niece, when she was pregnant with my great nephew. She was using not only the opioid that they gave her, but also heroin. She was shooting up with heroin. So she's getting a double dosage. As stupid as that sounds, because she's an idiot. That's all I can say, and I hope she watches this thing, because she won't. Her family hates me. And I don't know how she ever kept the pregnancy, but like I've said before, it took them 6 weeks to get to clean up the kid. He's a mess. He was a mess. And we're still not exactly sure how much damage has been done because of her drug usage. But she comes from a family that will not tell her that she did anything wrong. So everything's perfect. All of those children are just perfect, even though one's schizophrenic and the other one's a drug addict. And now we've got a little boy that is addictive. He's going to be addicted for the rest of his life. If the fetus survives these dangers, and usually they don't, it will be just as addicted at the birth as the mother is. Due to the size and dilution factors, the withdrawal symptoms are more severe. You can't give them anything. You don't know how much is in their system. It's not like somebody's cooking up heroin and injecting it. They know how much they're taking.
Yeah.
There's nothing we can do about the baby. And the baby cries like a cat caught in a screen in a garage door. Low birth weight, high-pitched cry, irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping.
Yeah, they have one of those lamb things in the VA in North Texas.
What happened?
The
Oh,
VA in
oh,
North
they've got it in
Texas.
North Texas, okay. Well, there you go.
It's at the VA.
I'm impressed. If the neonate survives the withdrawals, the effects will last for 5 to 8 weeks. And of course, this baby, they were trying to clean him up, and took him 6 weeks to clean him up. In the early 21st century, 4,000 to 5,000 people died from opioid overdoses every year. Last year, 130 people died from opioid overdoses every day. Every day, 130 people died every day. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. I can't imagine. Of course, have been out of medicine for about 20 years, but I can't imagine what it's like working in the emergency room at this stage. In one study, only 57% of opioids were accidental. The rest of them, of course, they took an overdose. What opioids overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate the blood. Because the heart isn't beating, the lungs fill up with fluid resembling drowning. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint. Respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as from the toxins. This is not a pretty death. This is an ugly, ugly death. And it's no fun for them either. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus. Within the last couple of years, we have discovered a way to cure hepatitis C. It's kind of exciting. 5 years ago, there was no cure for hepatitis C, and now we have one. A look at individuals who have only shot up for a year shows a rate of 71.4%. If you watch the advertisements on television for this medication, a lot of the individuals, some of them, they don't have any effect on their liver. Others, it does a lot of liver damage, hepatitis C. 20 to 40% of those infected with will develop liver disease. 4 to 16% will develop liver cancer. This is people with hepatitis C. 50% of all IV drug users are HIV positive. 50%. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are males. 7 to 10% of the HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexual or homosexual IV drug users. In the beginning, of course, HIV started in the gay community, and because of that, there were idiots that decided we weren't going to do anything about HIV. And so, unfortunately, there was a conservative in the White House at the time. Ronald Reagan was president, and because his base was conservative, evangelical Christian, he decided not to put any money into HIV research. As stupid as all that sounds, it all had to do with politics. Now, of course, they were claiming that it was punishment for people being gay. As stupid as that sounds. But of course, in sub-Saharan Africa, almost all of the people suffering from HIV are heterosexual, and it's from heterosexual contact. That's a lot of people. My goodness. How do they all fit in that? It's like a clown car sometimes.
That's a lot. I saw that too.
70% of the children with HIV have mothers who were IV drug users or the sexual partners of individuals who were IV drug users. IV drug abusers will do just about anything to get their fix. Heroin fairly quickly scleroses the veins, being used for injecting so that the individual has to go to more and more difficult sites for their fix. The wrist, of course, you've got blood vessels in your wrist. Between the toes, in the neck, if you've ever watched anybody inject themselves in the neck, even the dorsal vein in the penis.
The guy from my neighborhood, we call him Lonely Boy, you get nicknames, and yeah, he would slam right between his toes. But he's not with us anymore. But actually, he didn't die from heroin. He got shot. So that's sort of too.
A little bit faster. It's a faster way to go.
Yeah.
And probably if he was shooting up between his toes.
Pretty soon, like he had like no veins.
I know.
And I've seen them in the neck,
Yeah.
there's a vein in the head.
Yeah, this is-
Anywhere there's a freaking vein.
Yeah, this is where we start IVs in babies, right along the side of the skull. I imagine he was using the dorsal vein in his penis as well. You gotta understand, well, I mean, he didn't need it anymore to do anything but urinate because, I mean, he was on heroin. Heroin addicts don't care about sex, it's the last thing they care about. As much fun as that. Heroin users may inject themselves 6 times a day. 6 times a day! And sanitation is rarely the top priority. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. They'll get Staph aureus or Beta strep group A. Both of these things are quite virulent bacteria. Unfortunately, there is a strain of Staph aureus that causes, that eats their tissue. There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is a condition where the virulent bacteria gets under the skin and eats tissue away, and that's what's happened with this guy, as you can see, as attractive as that is. Endocarditis, bacterial infection of the heart valves. Cotton fever, short-term bacterial infections. This guy's from Scotland. A lot of heroin users in Europe, and there's a lot of, they have different problems than we have in the United States.
That's weird.
Yeah,
No, I'm just thinking about that.
it's pretty ugly. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The mean age of first alcohol usage is 16.4. The mean age of first tobacco usage is 17.3. The mean age of first marijuana usage is 17.4. The mean age of first heroin usage is 22.2.
What's the mean age mean?
Well, if we take all the people that drink alcohol, when did they start? Well, the average is 16.4. The average number. So you've got a 12-year-old here, you've got a 21-year-old over here. You know, we put them together, the mean age is 16.4. Okay.
And in Germany, it must be like 10.
Oh, sure. Well, I mean, the legal drinking age.
I heard it, as long as you can freaking reach the freaking bar, you can order it in beer.
I don't know about that. 16 is the legal age in Germany and France and
16?
in England. So.
Germany
16.
is the drinking age.
Yeah.
They serve beer at McDonald's.
Yeah. Oh, yeah. Oh, of course.
It's pretty damn strong.
From first usage to daily habit averages about 1 year of sporadic usage. And that's the way it works. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half were dead. Ah, okay. Yeah.
Sounds about right.
There we go. 50 to 100 times greater than the general population, of course. Well, how did they die? They died of overdose, accidental poisoning, homicide, suicide, accident, and liver disease, like Scott's friend who was shot and killed. He didn't die of an overdose, he died of homicide. 44% still used heroin, 67% used tobacco, 22% were daily alcohol users, 35.5% used marijuana, 19.4% used cocaine, 10.3% used crack, 11.6% used amphetamines. The group reported high rates of mental health and health problems. There's a shock for you. The group that now averaged about between 57.4 years reported frequent interactions with criminal justice system. There's a shock for you as well. 57.4. Morphine is metabolized by the liver 3 to 6 times. The morphine must be ingested to get the same effect as an individual gets from an injection. Morphine will be detectable in the urine for several days after ingestion, so there you go. And of course, my job, one of my jobs in the military was drug was a collection of drug urines. That was one of my jobs. Somebody had to do
So
it.
would someone like watch over the guys when they take a pee, or they just?
Somebody had to do it. They cheat.
No, I mean like when they're actually peeing.
Yeah,
Because in the army, I mean, we're like 2 feet away, all right, go.
yeah. Yeah, that was my job.
So,
It sucks, yeah. One of my favorite things is watching men pee. God. It was horrible, you can imagine. Oh my God. And then, of course, if you're watching, they can't go. So then you sit there and you wait, you give them some water, and then they try again, they can't do it. I've had people that didn't pee for 8-10 hours, and I had to watch them the whole time, because I was in charge. 1 out of every 6, you know the reason I got to do it? I joined the military right out of college, so I was already 21 years old. All the rest of the guys couldn't do it because they were too young to sign the, to sign the security sheet. I was the only one that could do it. It's a hell of a job. 1 out of every 6 Americans has chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. In one research of chronic pain sufferers, 72% had suffered for more than 3 years and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because fear of tissue dependence and addiction, fear that the painkiller would mask more serious diseases, fear that they might be thought as a drug seeker trying to supply a habit. So we've got a lot of people that are in a lot of pain who don't want to use opioids. They don't want to use painkillers, about half of them. Risk factors in morphine addiction includes kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible to addiction, and this is a problem. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. It's the #1 ranking, has since been taken over by hydrocodone, Vicodin. Vicodin, you probably get it in buckets. And distribute it in buckets, unfortunately. Pimp C and DJ Screw, dead from cough syrup overdose. There you go, those two rappers. They died of a cough syrup overdose.
I see, DJ Screw, he would like get all these rap stars and he would like actually make it slow.
Oh,
Screw and Chop. It's
Oh.
really popular in Texas.
there you go. Well, he's dead.
Yeah.
Dead. Also known as hydrocodone, also known as Vicodin, Hycodan, Tucin, and Norco. This is a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. 120 million.
That's not bad.
Not all of you at your hospital. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants, like alcohol. And I'm sure you give them a whole sheet of paper that says, don't take this drug with alcohol.
A lot of don'ts, yes.
Yeah, lots and lots. Methadone, Darvon, and Demerol were developed in German laboratories during World War II when the Axis powers were cut off from their supply of opium to provide painkillers of similar caliber to morphine. Methadone is less powerful than morphine and lasts longer in the individual system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States with 228,000 heroin addicts, including my niece. Hydromorphone is refined from morphine. It's dilaudid. It's gram for gram is 7 to 10 times more potent than morphine. Because of its potency, hydromorphone is stringently controlled. Oxycodone or Percodan is a semi-synthetic derivative of codeine and is used for moderate to severe pain. This drug is supposed to be taken orally. The effects begin after about 30 minutes. It actually slows down your stomach. Normally, if you swallow a drug, it takes about 20 minutes to get into your system. But oxycodone slows everything down. It lasts for 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine or Dilaudid. This drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing the strength of the tablets. Initially, they were pretty big tablets. Now they're not so big. Demerol or meperidine has been around longer than most of the synthetics and semi-synthetics. It is 1/6 the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing and have the side effects of constipation. This drug is most widely abused by medical professionals. No offense to medical professionals in the room. Talwin is a weak opioid antagonist as well as an agonist. When it's used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce the use as an opioid accelerant. This drug is rarely used now to get a high, but when I was in the service, Talwin was big. It was really big. Propoxyphene is also called Darvon, Darvocet, Propicet, or Wygezic. It is used for mild, moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of overdose deaths using opioids have been seen with propoxyphene or Darvon. They take it like aspirin. Anyway. Well, why don't we stop right here and we'll pick it up with fentanyl next time. Fentanyl, one of my favorites, all those dead people.